Hi everyone, my name is Quinette, and today I'll be talking about sexually transmitted bacterial diseases known as STD. So, STDs are infections that are passed or transferred from one person to another through, the key word is through sexual contacts. So, the sexual contacts can be either oral, vaginal, or anal sex. So bacteria that causes STDs, there are the main bacteria that causes STDs. They are, number one is gonorrhea. So gonorrhea is a sexually transmitted disease that, just like I mentioned, it affects both men and women. It causes infections in the genitals, in the throat, in the rectum, eyes, and joints. And just like I mentioned, mostly pass through either oral, vaginal, or anal sex. So this is the name of the name of the bacteria that causes gonorrhea is Neisseria gonorrhea, and this is what it is looks like in a plate. So just like I mentioned, Neisseria gonorrhea, it causes gonorrhea. Risk factors are, first of all, if you will be highly at risk if you have more than one sex partner, or if you already had gonorrhea, it can also come back again. Or if you have a new partner, maybe that has it, those can contribute to that. So complications are infertility in women and also infertility in men. And it can also increase HIV or AIDS. It can also cause complications. Let's say if a woman who has gonorrhea is pregnant, it can cause complications, in with the baby. So this is what I'm talking about. So I'm trying to compare someone that has gonorrhea and someone that doesn't have gonorrhea. So this is normal throat. This is someone that has a gonorrhea. This is a throat that has gonorrhea. This is a normal eye, and this is someone that has gonorrhea. And this is gonorrhea that affected someone in the joints. And it's known as gonococcal arthritis. So symptoms in males, mostly mostly there are no symptoms, but the symptoms are like the symptoms are not like a lot. So the few symptoms that someone can experience are painful urination, swelling of testicles, and then in females it's also the same thing: painful urination, vaginal bleeding between periods, and abdominal or pelvic pain. So diagnosis, before you are being diagnosed, first of all, a doctor has to run a urine test on you with your urine, and they have to use a swab. You have to use a swab to, like, just like we do in the lab. You run in the lab. You have to get the urine use a swab, a swab stick to like swab it, like get a sample and run in the test, and the result will come back if you do or if you don't, and before the doctor diagnose you with it. The treatment will be antibiotics. So um for this one you can use ceftriaxone or Zithromax antibiotics to clear it. Preventions, obviously, use condoms, use protection, limit the number of people you sleep around with, and make sure your partner is tested. Those things will help to limit and prevent you getting gonorrhea. So the next bacteria that causes STD is chlamydia. So chlamydia is, it's again, is they all spread through vaginal, anal, or oral sex, and it can cause pneumonia in newborns. So symptoms are painful urination, painful during sexual intercourse, testicular pain in males, and also abnormal vaginal discharge. So this is what I'm talking about. So these are the symptoms that you can see when someone has chlamydia. So pain during urinating, pain during sex, abnormal. This is normal discharge. This is abnormal. So complications are prostate gland infection. It can also affect newborns. It can also cause ectopic pregnancies. It can also cause infertility. It can also cause arthritis. It can also cause infections near the testicles, and it can also cause PID, which means pelvic inflammation disease. So prevention, once again, use condom, use protection, limitation of sex partners, limit the number of people that you sleep around with, and always get tested. Always get your partner tested. Always get someone who you're going to deal with, or who you're dealing with, get tested. Those things can prevent you from catching it, or prevent your partner from catching it as well. So diagnosis will be the doctor has to diagnose you. With this, the doctor has to diagnose you. Do you have to run run a urine, and they have to run a urine lab test on you to determine that. And the treatment will be antibiotics. So this time they're gonna use the oxycycline or azithromycin antibiotics to treat the patient. So the last bacteria that causes STD is syphilis. So syphilis is known as treponema 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 pallidum. That's the bacteria that causes syphilis. And the bacteria can enter your body through minor cuts, can enter your body through abrasion in your skin, little like scrape. But it's mostly spread through sex or kissing. So it can also be passed from one person to another through sharing of personal belongings, just like utensils, same toilets. So there are stages of syphilis. There's primary syphilis, secondary syphilis. Primary syphilis is like whereby there's a small spot. Like this, the sign is you have a small spot just like this. Just one spot, that's the primary syphilis. Then secondary syphilis, as the week progresses, you're not treating it or you don't find out yet, that one spot is gonna multiply to this. And then it will keep multiplying as it goes. And the level 3 of syphilis is latent syphilis. So in this, it can last for years, and this is the most crucial. You don't want it to get to this. If it gets to this, it can cause heart issues. It can cause brain damage, and you can never treat this one. You can never treat it when it gets to tertiary syphilis stage. You can never let this stage 4. You can never treat it. So this is the primary one, whereby there's one spot, secondary, and then this is the tertiary syphilis. This is the last stage. So the last stage, just like this, is like brain, like where like it caused like a damage in the person's brain. So risk factors are if you engage in unprotected sex, or having multiple sex partners, those can give you a higher risk at um catching it. So symptoms are um just like I mentioned, bumps, little tiny bumps can actually multiply either on your skin, on your liver, on your any part of your body. So complications will be you can damage your entire body. It can give you it can give it put you at a high risk of contacting HIV or AIDS. It can also cause complications during pregnancies. And another so it in the tertiary syphilis stage, it can also cause neurological problems, which are it can cause stroke, it can cause dementia, it can cause headache, hearing loss. And cardiovascular problems will be it can cause aorta to damage, and if you have taken an enemy, you know that without aorta you will be dead. So aorta is the main blood vessel in the body that transmits blood into the tiny blood vessels. So if the aorta is damaged, the person will die. It can cause death, and it can also cause the heart valves to damage. So prevention will be monogamous. Always go with one person, not multiple. Using protection and also getting tested too. So the treatment will be penicillin G, antibiotic penicillin G. So quick story. So this is a real case study. So these people were doing a case study whereby they came across this man in Asia, and they didn't actually this man initially when they wanted to use him as like a case study in their case study, he didn't actually agree to it, but later on he gave in and allowed them to use him in the case study. So they actually took a sample of this stuff on his body, on his skin, to run in a lab, and they found out that this is syphilis in the last stage of syphilis. Mind you, this is how your body will be. It will never be eradicated. It will never be cured because it has gotten to the last stage. So after like few months, when they use like heat therapy, they use antibiotics to cure, to like be giving him to like to get him to feel better. After months, they came back and this is his body. So these parts will never go away, but they will shrink, but they will never go away. And mind you, you have to keep watching it because it can come back again. It's not like it has been disappeared. No, it can come back again. So when it gets to, don't allow it to get to this point. If you have it, just make sure you get screened, you get tested so that you don't allow it to get to this point. So this man was lucky that he agreed because after the case study, after his treatment, he was better. He felt better. So yeah, that was the end of my presentation. Thank you guys. Thank you for listening.